Oh, it's just for the recording. Okay. So I'm using this one as well. There we go. Sorry. So today we're going to talk about food and mood primarily because most of our data clinically is with food and mood and overall diet interventions. So Dr. Crawford made the point that psychiatry and world psychiatry organizations and the American Psychological and Psychiatric Associations, they have, there's nothing in any of mental health and public health that they talk about nutrition. There's certainly those with endocrine societies, cardiovascular disease, gastrointestinal disease. Everyone admits, obviously, food is a major contributor to to those diseases. But came out actually very recently in the Lancet, although determinants of mental health are complex, the emerging and compelling evidence for nutrition as a crucial factor in the high prevalence and incidence of mental disorders suggests that diet is as important to psychiatry as it is to cardiology, endocrinology, and gastroenterology. And it's starting to come out in the public. This was Scientific American Mind not too many years ago. Your brain takes up 20% of your daily calories. It's consumes 60% of the glucose you eat every day, and it's 60% fat. It has highest concentration of PUFAs, obviously of any land mammal, and it's the largest deposit of cholesterol in the body. And this was my point I made earlier. You see all of these brought out by endocrine societies, American Heart Association, etc., all about diet. Psychiatry, we don't have any packets like that to hand out to people. And the Dietary Guidelines for Americans, it was last revised in 2015. It was shifting, wasn't talking about the food groups anymore. Cholesterol was taken off as a nutritive concern, but there was no mention of mental health. All right, so when we talk about what's for dinner, we want to talk about nutrients, epidemiology, and then sustainability. And so here is one of the first studies, Sanchez-Villegas, back in 2009. Again, a lot of what I'm talking about is relatively new research. The basic research we knew already, but it's only been about 10 years that we have good evidence for nutritional psychiatry on a large clinical level. So this was a study just showing, epidemiologic study, reviewing the diets of all sorts of people, and they observed that people who ate higher of sort of a Mediterranean diet seem to have about 40 to 60% reduced risk of depression over a period of 5 years. And then growing brains need brain food. So this was one of the first papers by Felice Jacka, who's one of the premier researchers in food and mood. She checked the diets of 7,114 adolescents, and they just did their diets by quintiles of healthy and unhealthy. And the teens with the lowest quality diet were 79% more likely to get depressed. And as you can see, the relationship between unhealthy diet and depression was linear. Mostly when they're talking about unhealthy diet here, there's a little bit of mixed signals. Some of them will say high fat, high sugar diet, but really what we're talking about are the Western diets, which is going to have your trans fatty acids, lots of fast food, so lots of sugar and sort of unnatural fats together. So this is the healthy dietary pattern in depression. This is a new meta-analysis. Actually, no, sorry, this is the one that's all of the observational studies over time. So we can only learn so much from observational studies, but overall, you can see with the diamond at the bottom that a healthy diet gives you about a 20% reduced chance of developing depression over time in this large meta-analysis. So let's go on to randomized controlled trials, which are definitely more interesting. This first slide was one of the first randomized controlled trials of a total dietary intervention where they measured depression. This was the PREDIMED, which has some problems. So some of the data, we want to take this data with a grain of salt. But what's interesting about it is that they actually compared two dietary interventions, a classic American Heart Association diet, which is low cholesterol, low fat, versus a Mediterranean diet. And it was mostly for a cardiovascular trial, right? Heart health, as most of these large dietary studies are. but they happened to measure depression as sort of a secondary endpoint. They had people fill out some screening tests about depression. And they found that people in the Mediterranean diet, compared to the American Heart Association diet, had a lower risk of depression. This is a brand new meta-analysis of randomized controlled diets in depression. Again, most of these were not on a depressed population. This was mostly on a general population, and mostly they're studying other things like rates of diabetes and cardiovascular, but all of these happen to have secondary measures of depression. There are some studies where they went straight for a depressed population, trying to see what diet does to them. We'll talk about those. So this just came out a month ago, and as you can see from the diamond there, again, you're looking at your odds ratio around 0.8, a 20% reduced risk of depression. We did a whole dietary intervention. There was also a study, this is anxiety. The signal is less strong, but significant. So now we're going to talk about a couple of the trials they took up a small population of people and trying to reduce depression by changing their diets. I sort of like the studies by Stahl. It was in the American Journal of Psychiatry in 2014 because this study was an accident. They had two parts of the study. They were taking older adults who were at high risk of depression, so they already had some symptoms of mild depression. If you have an older adult with mild depression, they're actually at very high risk to develop a major depressive disorder over the next several years, and it's difficult to treat. Medications don't seem to work as well in the elderly. And so they were trying two interventions. One, just something you could do in a primary care clinic, very mild life coaching, mild kind of therapy. You didn't necessarily need a trained therapist to do it. Just gave us some time in talking about problems. The second arm of the study was meant to be the control, and that was actually teaching people how to cook at home. So they were giving them time and attention, but they thought that teaching them how to cook wouldn't affect their mental health. And they failed because affecting their mental health was actually just as effective as the therapy intervention. And so the two arms of the study had equal a decrease in depression, decrease of risk of depression over the next several years. And so they failed in their study, but they got 2 papers out of it instead of 1. So this is the only relatively large randomized controlled trial of dietary improvement for adults with major depression. It's called the SMILES trial, and it was Felice Jacka, and she completed it a few years ago. And what they did was they took adults with major depressive disorder in a psychiatry clinic diagnosed, and then they had a group that they had 9 meetings, taught them how to cook. They gave them a little basket with Mediterranean diet, and then they followed them over time. The second group, they just had sort of a group, it wasn't therapy, just sort of a group meeting and intervention and talk. And what they found was baseline, and then after 3 months was a significant decrease in the MADRS, which is a relatively common screening score for depression, compared to the social support intervention. This intervention was actually about as strong as antidepressant medications. Now, this group was taken from a psychiatry group, so many of them were also on antidepressant medications as well. The main problem she had, and I can tell you, was in recruiting people for the study. It's difficult to get people who are significantly depressed to change their diet, exercise, other things, because it affects motivation and energy, right? But she found that if you can do that, it's definitely worth it to get people to eat more of a whole foods dietary pattern. So this is just kind of a funny thing, you know, how primates being affected by mental health. If you look on YouTube, there's a little 3-minute video called Gorillas Beat Disease with Diet, and it talks about these gorillas that they had at the Cleveland Zoo, and they had these behaviors like they were ruminating, which means they're eating and then they're spitting it up and then eating it again, and they were also picking all their hair out. So when we're anxious, you know, I have a lot of people who pick their hair out, chew their nails, things like that. And what they did, and again, this was a surprise, so the main issue is that they had a gorilla who died of a heart attack, right? So they changed their diet from gorilla biscuits, which is sort of their version of the Western diet, to what gorillas eat in the wild, which they eat about 11 hours a day. Their colons, I think, are 7 times as large as ours. So they give them a lot of romaine lettuce and a lot of green food. So in addition to their cardiovascular problems getting better, their psychiatric problems got better as well. So they were no longer ruminating and they were no longer picking, and they weren't anxious. All right, so mechanisms. Part of its nutrient deficiency is a problem for our brains, neuroplasticity, and BDNF. BDNF is brain-derived neurotrophic factor, which is brain fertilizer. It helps our brain recover and repair. Inflammation, plants, the microbiome, and then toxic diet effects like trans fats, food dyes, and medication. And what I mean by medication load is if someone has lots of cardiovascular disease, diabetes, kidney disease, there are tons of medications. A lot of our medications are anticholinergic. They affect cognition, they affect sleep, they affect movement. So if we can reduce that medication, chronic medication load, we can often help the brain. All right, so talking about inflammation and depression, all these are predisposing factors: adiposity, history of major depression, early life stressors, gut microbiome. They all can kind of come together. Negative health behaviors, negative outcomes, persistent inflammation in the body, long-lasting depression symptoms, further exaggerated responses, and it just kind of goes around and around and around and around. And then we have a little bit more data, sort of what I was talking about before, but they more specifically measured measures of inflammation in the body. And so if you have lots of alcohol, lots of caffeine, crappy diet, inflammatory diet pattern, which is, again, our Western diet, you had much higher risks of depression. And again, we're talking in the 40 to 60% increase. And so these were the things like margarine, carbs. They added red meat in these things, Coca-Cola. And this was considered the healthier diet, which was vegetables, coffee, olive oil, and red wine. So it's not necessarily what we would pick as a healthy diet, but mostly you get at that signal of Western diet, lots of processed foods versus more whole foods. And this was just, it's a little complicated, but they measured IL-6 and CES and other kind of measures of inflammation in the body, and they found that people who combined high inflammatory markers plus a lousy diet were way more likely to get depression than those with low inflammatory markers and a healthy diet over 6 years. And this was interesting too. This is another JACA study. Obviously, I love Felice JACA a great deal. So she measured the hippocampus of adults, older adults over time, I think ages 62, and then again 4 years later. And those with a poor diet had a large decrease in the size of their hippocampus over 4 years. You see, so blue is age 62 and red is 4 years later. And you had a smaller decrease in the size of your hippocampus if you had a good diet. All right, so I wanted to talk here a little bit about one of the ways. So one of the ways is nutrients, the fats. Obviously, Mediterranean diet is obviously a way of taking a whole foods diet and adding lots of seafood, as Dr. Crawford had talked about before. And that's why it seems to beat the signal of a lot of these other diets, especially for the brain. But also a whole foods diet interacts favorably with our microbiome. We first started studying the microbiome in 1683 when Leeuwenhoek looked through his microscopes and saw, he scraped his teeth and he saw little living animalcules very prettily moving. But we really didn't know much about it until we started doing PCR and other kind of DNA measuring techniques many hundreds of years later. And as you can see, the human microbiome has, 1 million plus genes. I think there's about 100 trillion little beasties living in you and on you right now, and we only have 23,000 genes. We've coexisted for as long as we've, evolved together. The microbiome it's a jungle in there. There are predators. There are, happy helpers who help us out. They all kind of live together in balance, and you can unbalance that, and that can cause health and disease. So that's just a pretty picture. So there's bidirectional communication between the brain and the microbiome. If you take a mouse away from its mother, the gut flora of the mouse is altered. Stress and sleep deprivation affect human gut flora. We have increased translocation of infectious bacteria in patients with major depressive disorder. And there are 200 to 600 million neurons that directly connect the gut and the brain. So this is an interesting point. A lot of our gut microbiome makes neurotransmitters that go to the vagus nerve and talk to our brain. So they are talking to us, and they can affect our mood, and they can affect our cognition. One of the signs of ulcerative colitis and other SIBO, so increased growth of bacteria at the top of your small intestine where it shouldn't be, is profound brain fog and inability to think cognitively. So my point here in this slide is that if you're thinking about getting a fecal transplant, make sure it's from someone who's fairly mellow and clear-headed, all right? So this is just how it affects the brain. There's multiple things. So it has direct communication, but also the microbiome has a profound effect on the inflammatory response of people and the immune response of people, but also directly on the endocrine system. So it can send out signals to our endocrine system that can basically increase stress and inflammation. And increasing stress and inflammation is exactly the pathology behind mental health disorders. And here's just another slide showing the same thing a little bit more specifically. What's interesting about this slide is that as a psychiatrist, right, I prescribe a lot of medications. A lot of what I do is in that part up there where you have increased IDO and tryptophan goes down. So tryptophan is the precursor for what neurotransmitter? Serotonin, right? So the gut pathogens can cause decreased change of tryptophan into our serotonin, and instead it goes into chironine and these other altered serotonins that are associated with higher rates of suicide and mental illness. So they're kind of making this note that if you maybe put in probiotics here, this is a little simplified because this is from 2012, and our understanding of the microbiome is much better now than it was in 2012. So probiotics could cut off this signal and do something a little bit similar to what maybe an SSRI would do. All right, so when you study the microbiome, you get really complicated plots like this, because again, there's 100 trillion of the little beasties and they all communicate with each other. I think we really need ecologists to properly study these. So this was an interesting study. They took men in South Africa and they took men in the American South and they switched their diets. So they put the South African men on, I don't know, mostly McDonald's, I guess, and they put the men in the American South on, lots of beans and whole foods. So butyrate-producing microbial species are thought to be very helpful, and they increase, what do you think, in about 2 weeks? How high do you think it went? Any guesses? Just throw out something.
20%. 8 times.
All right, 250%. So we're close. So your diet can affect your microbiome profoundly and very quickly. And these are just different studies, going back and forth between the microbiome and things like schizophrenia, anorexia. There's bunches of studies on these. In fact, you can take someone's fecal bacteria, you measure their fecal bacteria, and in some of these studies, they were able to tell they were blinded, they were able to tell which people were depressed, which people had schizophrenia, which people had anorexia. It's really quite amazing. Early on, it was all classification. Now we know that the microbiome, it's probably much more important to think about the function of the microbiome. So your microbiome, it digests food for you. It also produces things, again, like butyrate, which we were just talking about, propionate, acetate, and different microbiome. So a microbiome for someone who's maybe a vegan is going to be very different from someone who's like a carnivore. But they might, in their separate ecologies, have all of their same metabolites that we need. So it's, when you talk about just the classification of the microbiome, we really don't know necessarily what we're talking about. In addition, how do we classify the microbiome? Genes, right? They swap genes all the time, so we don't know who's down there. Really, we only know how effective it is by basically your health and then some of the metabolites of the microbiome. So this was a very interesting recent study where they took the microbiome of patients with schizophrenia and they stuck it in mice. Just with this change, they were able to change the behavior of the mice, and they changed the output of the microbiome, and then they were able to measure systems in the brain. And so again, just this change in the microbiome of this mice changed the GABA and glutamate production of the brains in these mice. And this is just a pretty simple slide showing all the connections between the microbiome and the brain. This is a great, actually, open access paper, a great introduction to this if you're interested. It's Wang et al., Brain Behavior and Immunity in April of 2014. So when I ask my patients, do you eat a healthy diet? Generally, this is changing a little bit. They're saying, I count calories, no cholesterol, I avoid fat, no red meat, right? And this is the percentage of the US population not meeting the RDA. So, and the fats aren't here, sorry, Dr. Crawford, but see folate, magnesium, zinc, all, vitamin B12, all very important to the brain. And a lot of us in the US aren't meeting the requirements. This is just a study showing that we eat a lot of garbage. This is teenage boys, 273 calories a day of soda and energy drinks. And that's a lot of calories. This is a small, kind of silly study, but increased soda consumption correlated with poor mental health, increased aggression and violence. It was linearly correlated with stabbing violence in this study in Boston. So inadequate intake of vitamins and minerals is most common among of any population? Teenagers. And that's your final push to develop your brain, right? Oops, I'm not sure what that was, but I think it was a picture of omega-3 fatty acids, which are important. So this is just some common foods. Does anybody know what these are? Right. Oh, you guys are smarter than my usual group. And there's little nut clams. So there's lots of vitamins and minerals in different foods. Liver is at the top, obviously. Chocolate supplies 97% of your iron that you need during a day. So this is, when you think of a psychiatrist, you think of usually this is what we're doing. We try to block all the receptors. But we're talking about the pharmacy instead of the pharmacy. And this is my friend, Dr. Drew Ramsey, has this brain food prescription that he gives out to his patients. And as you can see at the very top, seafood, vegetables, eggs, chickens. And he talks about different food swaps to make it easy. Dark chocolate almonds for white chocolate pretzels, beef stew instead of hamburger, salmon burger instead of a fried fish sandwich. And 6 oysters, 31% of the zinc, 245% of our iron, 76% of our B12, 509% of our long-chain omega-3 fatty acids. How many calories do you think are in 6 oysters?
80.
Yeah, it's like 91, I think. So that's a lot of bang for your buck. They make me sick, unfortunately. And again, Dr. Crawford already covered this, but omega-3s are vital for membrane signaling. And there was a study, women with low DHA were 6 times more likely to suffer from perinatal depression, and he already discussed the higher risk of mental disorders later in life. Another interesting study I didn't throw in here, they gave women probiotics to modulate their microbiome. They studied them over their kids over 13 years, and they were in the control group. There were sort of the normal cases of ADHD and autism spectrum disorders. In the experimental group that got the probiotic, there were 0 cases. So I thought that was interesting. Fish and fat intake. A greater intake of fish, EPA, and DHA independently associated with lower prevalence of depressive symptoms during pregnancy. And these are just some examples of some cool foods. Lots of people with depression have impairments in their methylation cycle. And so having plenty of all your things, riboflavin, B12, B6, can help you make your neurotransmitters much easier and your DNA. Flavonoids in different colors of foods, they probably work by accelerating our antioxidant capacity. It makes more sense to eat blueberries than to eat some sort of weird powdered blueberry extract. And then nuts and seeds, they actually have lower calories than we thought and it seems to be lower carbs because a lot of it is not a net carb. And they contain a lot of nutrients. They have phytic acid, which binds them, but you still get some. And so here was just an example. They compared a Mediterranean diet plus olive oil versus a control versus a Mediterranean diet versus nuts. And they had low BDNF. Remember, that's the brain fertilizer. Nuts decreased the amount of people with very low BDNF concentrations. So I'm just going to kind of skip some of this. A lot of people have questions about gluten and psychiatric disorders. So about 2% of adults are going to have celiac disease, up to 6% a gluten sensitivity. It's very rare to have a flat-up wheat allergy. But when they did the largest study of the schizophrenia, the CATIE trial, it's about 4,000, 5,000 people. 23% of schizophrenics had an IgA antibody to gliadin, which is in wheat, versus 2.3% of the general population. It's a double-arrowed, so people with schizophrenia are much more likely to have celiac, and people with celiac are more likely to have schizophrenia. And this is just how celiac works. It breaks down the zonulin, and you end up with what's in your gut going into your body without being digested, and that's not good. I include this one because this is actually my patient. It was in the New England Journal of Medicine. She had delusional disorder, began in her mid-30s. She had no prior history or family history of psychiatric disorders. Nothing worked, no medications worked. She was psychotic for about 3 years. They finally figured out she had celiac disease. This was before I saw her, though I might have missed it as well. And when she went on a gluten-free diet, her delusional disease, she was hospitalized for a year at a time. She was completely recovered and able to function. And when she would eat wheat again, she would get delusional again. We were able to confirm this with her anti-TTG IgA level. Obviously, I didn't want her to eat wheat. All right, and so again, going back to sort of different foods, we're talking about meat and eggs. We get heme iron, protein. We like grass-fed and pastured beef because it has more of the omega-3s, but not enough. And this is the kind of meat that we eat. This is sort of a disaster for the environment. This method actually sequesters carbon, like our oysters. So you pastured ruminants. A big study just came out a few months ago showing that it did sequester carbon. This is actually my family farm, and that's my husband and my daughter. We don't live there, unfortunately. And again, when we're talking about meat, and I think this is an important distinction when we're talking about the Western diet, you know, there's that meat and then there's that meat, right? And eggs are a really good source of nutrition. It's kind of your organ meat if you don't like organ meats. There was a study in the American Journal of Psychiatry. They gave pregnant women choline supplements or phospholipids, and they found that the babies had better cerebral inhibition at 48 months. So again, they fed the mother and then they followed the babies. And what does that mean? Well, low levels of cerebral inhibition is highly correlated with schizophrenia. It tends to be genetic. So there's a question, and they're actually working on this. If you have people with high risk of schizophrenia and they're pregnant, you give the moms choline and see if that might not decrease their risk. It's a hard study because it takes about 20 years for that to develop. All right, so can you eat to build a better brain? You can. Go for colors, fats, flavor, and fun. Don't be scared of fish. The whole foods or Mediterranean diet pattern is protective. And learn from history. Put the genie back in the bottle when it comes to soda, trans fats, that kinds of thing. Counter brain nutrients, cut out processed food, fix fats, eat your omega-3s, eat plants, and move to complex carbs rather than refined carbohydrates if you choose to. And this is sort of my question slide, but I think we're going to the, of course you feel great, these things are loaded with antidepressants. Right. The end.